Good morning, everybody. So it's an honor for me to be able to present on some of the results of studies I've performed in the past few years. I will tell you a bit more about the importance of green space for our health. And in the beginning, earlier this morning, Mr. Rijmakers already introduced the topic a bit to you because he told you that indeed greener cities also have an effect on our well-being, on people being more physically active, people in neighborhoods being more, having more social contacts with each other. And if we know this, okay, for me it's also next. Yes, it's working. And if we maybe already think that green space is good for our health, then it's rather strange that still, although of course we all work hard to get the movement of greening cities working, but if we look at where most people live, then it is in living environments like this. We work in environments like this. And exercise, most people exercise in sport schools, or even when people have to rehabilitate, they exercise in environments like this. And that is rather strange, I think, and especially what I normally do when I have a lot of time for my presentation, I ask the audience, I show them two pictures and I ask them, okay, what environment would you rather live? And I show this one, and then after that I show this picture. And if you look at the responses from the audience, I constantly get when I'm presenting or asking this question, then most people state that they have a preference for living in this greener living environment. And so that makes it even stranger that somehow we managed to work, live, have our health services in environments where there's little green space. Actually, in our daily lives, we have to put effort in it to really visit natural areas or actually see green space. And while at the same time, people actually prefer being in green environments. And this has already been explained by the biophilia hypothesis. And this hypothesis states that people feel an innate tendency to seek contact with nature. And if they do seek this contact with nature, they will get healthier and happier from this. And this hypothesis was already postulated in 1984. So where did it go wrong? Why did we think somehow that we could make our work environments and living environments and remove all this green and only see green, as Mr. Rijmakers already said, as a luxury and not as an essential part of our living environment? If we talk about health, maybe part of the reason why we thought we could just remove all this green space from our living, work, and so forth environment could have to do with the fact that there actually wasn't that much research which actually proved that there is a relation between green living environment and health. So in 2004 in the Netherlands, they did a systematic review and they looked at all the international publication on the of research on the relation between green space and health, green space in the living environment and health. And they only found 2 scientific studies in all this international database with literature. So they're actually, we all feel that it's healthy, we have a preference for it, but there wasn't any evidence for it. And that could be a reason why policymakers say, okay, yeah, it's nice, green space, but we don't need it. We don't have proof that it's healthy, so why should we include it? Fortunately, this has all changed. So especially in the last decade, the amount of research investigating the effects of the amount of green space in the living environment and health has risen enormously. And these are some of the reviews that have been done. So now, because there's more research on this topic, a lot of researchers try to combine all these studies and see what the results are. And what we can see, and I think this, I don't want you to remember this whole figure, but just look at the side on the red box. There are numerous health outcomes which are related to green environment. So exposure to green space or living in a greener living environment is associated with, for instance, a lower incidence of depression and anxiety. People suffer less from ADHD in a greener living environment. There are less people who are overweight in a greener living environment. Mortality rates are lower, and maybe Jelle already explained a bit why that is. Maybe it has to do with these heat effects. So we can see migraine is lower. So we can see that a lot of health outcomes are lower, are not presented as much in a greener living environment. To give you an example, we performed a study several years ago where we investigated how often people visit the general practitioner with certain health complaints. And we looked at the amount of green space in the direct living environment and compared people who lived in a really green living environment to people who lived in a barren, grey living environment. And what we could see is that the prevalence of, for instance, migraine, depression, asthma, and diabetes was 20 to 25% less in living environments with more green space. So 20 to 25% less people visited the general practitioner with these complaints. And especially for depression in children, we could see that there were large differences in the number of children that visited the general practitioner with depressive symptoms. And that's interesting. And that's also what our Ministry of Agriculture thought. They thought, okay, but if less people visit the general practitioner, then we can save money if we invest in green space. Yes, that's true, we can. And a company in the Netherlands calculated what if we put down 10% more green space in the whole of the Netherlands, what would that save us in costs? And they calculated that we could save 65 million in healthcare costs yearly and 330 million euros in labor costs. Because there you can really save money, because people who won't call in sick or go to the general practitioner have a lower chance of calling sick at work. And if you are sick at work, it will cost the company a lot of money. So there's actually money to be saved if we invest in green space. And what makes green space such an interesting instrument, that's how I see it basically, to put into place to stimulate people's health, is because green space can stimulate our health through several mechanisms. First of all, and there's a lot of research about that, green space, exposure to green space, basically merely viewing pictures of green space can already help to reduce stress or to recover from stress. People who walk in parks instead of in an urban environment show more positive emotions and less negative emotions. And also, exposure to green space can help our attention system. So if we have to pay attention for a very long time, like we do have to do now, then at one point you're easily distracted from other things in the environment. And if you then would look at green space, then your attention system could recuperate and you can pay attention a bit better. That's what research tells us. So that's the first mechanism. It has an effect on our stress, on our psychological well-being. The second mechanism, and that's what Mr. Rijmakers already told us this morning, what we can see is that if you are exposed or live in a greener living environment, that in those neighborhoods there's more social cohesion. That could have to do with the fact that, for instance, in the Netherlands we have front gardens, which are sometimes green, if people are, have a green front garden. And they have to, of course, take care of that garden. So the chances of meeting your neighbors are higher. And if you meet your neighbors, you're more inclined to talk to them. So those simple things can help for the social cohesion in the neighborhood. We also see that people are more physically active, for instance, and that people who have a vegetable garden, for instance, that they eat healthier. And there are also a few studies which show that people who live in greener living environment or people who garden more often, that they have a better sleep quality. So basically, green space with this one instrument, you can impact all these lifestyle factors, which are really important for people's health. A third mechanism is that green space can enhance our immune functioning. And that has to do with the fact that in these greener, more biodiverse environments, people are exposed to more diverse micro and macrobiota. And these micro and macrobiota, they stem from the bacteria and I have to check, this is always essential substance from plants and trees. They excrete these micro and macrobiota. And these micro and macrobiota are really crucial for our immune system as well. So the substances that plants and trees excrete are really important for our immune system, and so it can help enhance immune functioning as well. And we already, health is also related to a lot of environmental nuisances. So we have the we see that in greener living environment, there's less. The heat is not that big of a problem. The air quality could be better, but that has to do with how the green in the neighborhood is designed, and we see less noise nuisance. Sometimes in neighborhoods with more green. So with this one instrument, I always see it, we have not green in our hands, but gold in our hands, if we look at what green space can do for our health. So the way I see it, and what I do in my line of research, is I think it's important to stimulate people to have daily contact with nature. So I focus in my research on bringing green to people, greening living environments, greening healthcare environments, greening school environments. And for the past few minutes, I see I have 7 left, I would like to focus a bit more on 2 of the settings I conduct research in, and that's schoolyards and in healthcare facilities. Why schoolyards? There are several reasons for that. I think the most important reason would be that if we connect children to nature, the chances are higher that when they are older, they also want nature in their environment as well. They have scientific word, the shifting baseline syndrome, because children now are less exposed to these biodiverse environments. They will never ask for it because they haven't come across them. They don't even know it exists, and they haven't experienced what such an environment does for them, what it can mean for them. So they won't ask for it. So therefore, I think it's really important to start connecting children to nature. And what's the best way to do that? Well, every child has to go to school, so we should think of greening these school environments. This is an example of a schoolyard in the Netherlands. I'm not sure if it looks like this in other countries as well, but there's hardly any green space. But in the past, I think 6-7 years in the Netherlands, more and more schools are creating a natural playground at the schoolyard for their children. And this is interesting, because first of all, because children are exposed to these green spaces, and chances are higher that in the future they will also ask for these kind of environments when they grow up. But also, what we've seen is in literature is that exposure to nature is basically interesting or stimulates all developmental domains of children. We want our children to develop in a healthy way. And what we can see, if we expose them to nature in their childhood, their physical, cognitive, social and emotional and moral development can improve for that. So, for instance, studies have shown that children who play more often in natural areas, their motorical development is better. We can see that children concentrate better after they do a task in a garden, a green environment, as opposed to in a classroom. We can see that if you have loose elements at a schoolyard, that the play is different, and that they, for instance, work on building huts or trying to build something, and they have to talk about that to each other, and they have to find solutions. How can we put that branch in a good position so it won't fall down? And all those things, if you succeed as a child in those things, it can help your in self-confidence. And also, it has an effect on moral development, because you have to take care of the green space, which it is also related to more pro-environmental behavior if you're in your childhood exposed to nature. We investigated the effects of green schoolyards using a prospective intervention study where we included 9 schools. 4 of those schools remained grey, as we mention it, and 5 of the schools greened their schoolyard. And we found that children were, especially girls, were more physically active, that children played more varied. So at the grey schoolyards there's more play with rules, so like soccer and those kind of games. And at green schoolyards, they play more exploratively, they manipulate things, they play more dramatically. So, and those kind of plays are important for children's development. Children could concentrate better after a break at a green schoolyard. There was less bullying at green schoolyards, more social cohesion at these schoolyards, and children could perform better on a task for creativity. So that's interesting. If you would be interested in working on these green schoolyards, I see a trend in the Netherlands as well. What they often do is put down artificial grass and with wooden play elements. That's not a green schoolyard. And we designed a tool, a quality tool, to help designers and also schools to develop green schoolyards that can really stimulate both biodiversity, climate change. We also work together with climate, not change, but climate resilience, and also development of children. It's in Dutch still, but if you're interested, we have a translation and we can send it. I have 2 minutes left. I have 1 setting left. Can I go for it? Yeah? Okay, great. Okay, so, and then it's not working anymore. Yes, thank you. Yeah, so that's for the green schoolyard setting, and I really wanted to present that to you because I think and feel that that's a really important setting. Another important setting is the healthcare setting, and I today chose hospital setting to point that out, but we are in the Netherlands also working on mental health care institution and trying to stimulate the psychologists to go outside with their patients instead of sitting opposite to each other, walk beside each other in a green environment, and that can have an enormous effect on the client and also on the psychologist itself. But for hospitals, we often see environments in hospitals where there's little green space. And that's a pity, because what we know, if you go to a hospital, you're stressed, you're full of anxiety and those kind of things. So you want people to feel good. And there are a few studies which have shown that basically it's good to have green space in these healthcare facilities. For instance, a rather old study showed that people who recover in a room with view to a brick wall needed stronger painkillers and could go home a day later than people who recovered in a room with view to a tree. So I think designers of healthcare facilities should think about the view. What can people see from their bed when they're in a hospital? There's also a study on plants in hospital rooms. That's also a bit tricky because they are afraid of bacteria and so on, but I think there can be solutions for that. But one study showed that if there are plants in your room when you recover from surgery, that the patients in such a room feel less stressed, also need less strong painkillers, have more positive emotions, less negative emotions, and they could also go home a bit earlier than the people who didn't have a plant in their room. And a garden in a hospital can also have a really interesting function. So this is a study from children's hospitals, and children who visited that garden showed less negative emotions. So you can imagine for a child to be in a hospital that he feels worries, maybe a bit angry, sad. But if he goes to a garden, afterwards they have less of those negative emotions, and I think that's really important in the long while. And when children look back at their stay in the hospital, it's important that it's a more positive view. So for patients, this green space can be really important, but not only for patients. It can also be really important for the healthcare professionals. And we've all heard about the people on the intensive care unit with corona and how stressed they were. And I often thought, I wished for them that they had an outdoor environment where they could just be away from all the stress inside. If it was only for a few minutes, but during their break, I think that can really help them. And one study indeed showed that if nurses from an ICU unit have one break during the day in a green environment, they show less burnout symptoms. So I hope with this quick talk, I have so much to talk about, but that I have inspired you a bit to also look at these settings when we try to green cities. Thank you for your attention.
So Jolanda, you say during the lunch break, take your sandwich outside.
Definitely.
And go in the green, because it's top sport this morning, eh?
Yeah.
Yeah, but you can manage. Thank you so much. It was
You're
very
welcome.
inspiring. Jolanda Maas.